It was on 7th of April when he developed a heart attack. Then they said they could not refer us there and then because the blood pressures were very high. So they had to first stabilize for 3 weeks. Then when we reached the Yashoda hospital, we saw Dr. Vikram. I am called Virunji Mary. I am a midwife working with Kakumio District Local Government, and I'm the wife to Mr. Sally Joram Siktoreko, who is next to me, and he works as the Principal Administrative Secretary, Kakumio District Local Government. He started by having dizziness and hiccups in 2017. He went to clinic, they took blood pressure, and it was found high. Then he went to hospital. They did several investigations. They diagnosed him as having high blood pressure and cardiac problem. They started on him medications. He has been stable for that time, and he used to go for reviews. But it is just of recent, it was on 7th of April when he developed a heart attack. He had gone to give a speech. That's why he got that problem. Then they brought him when he was sweating so profusely with a very severe chest pain. We rushed him to clinic. They gave first aid. Then they referred us to Mulago Hospital, where they did several investigations and confirmed him having aortic dissection. Then they said it was type A, they could not manage. They referred us to India, Yashoda hospitals. Then they said they could not refer us there and then because the blood pressures were very high, so they had to first stabilize. We stayed in Mulago for 3 weeks. We got a flight on 30th of April. The doctors in Mulago told us to take medication 1 hour before the airplane landing, and it's what we did. Then when we reached the Yashoda hospital, we saw Dr. Vikram. Dr. Vikram requested to repeat the investigations. They did and still confirmed the same diagnosis. Then he planned for surgery, which was done on 5th of May. The surgery was so complex, it took 13 hours in theater. From there, they took him in ICU department. That's where they managed him for 1.5 weeks. Then they transferred us to a private wing. I want to thank the ICU team for the great work done. I want to thank the operating team. It really worked so tirelessly to see that my husband's life is preserved. I want to thank the Almighty God for having preserved my husband's life. I want to thank His Excellency, the President of Uganda, the Prime Minister of Uganda, for the great support given to us. Thank you so very much.
I'm Dr. Vikram Mehra. I'm Senior Cardiac Surgeon at Yashoda Hospital, High-Tech City. Today I'm going to talk to you about one of our patients, Mr. Zoram, who has come all the way from Uganda. He was diagnosed with acute type A dissection. This is a very serious condition where the mortality is very high. So he was successfully managed there on medical management and was referred to Yashoda Hospital for further management. So for him, Mr. Zoram, he underwent aortic root replacement, which is called the Bentall surgery, which involves the replacement of valve, ascending aorta, and he also had extensive surgery replacing the total arch, aortic arch, with replacing all the vessels supplying to his brain. And it was a major surgery which took 8 to 10 hours, and post-operatively he did very well, and we managed him. with our excellent ICU critical care, and we are happy with his recovery. I have to tell you, the Yashoda Hospital, High Tech City has all facilities to manage such type of complex cases which require extensive cardiac, neuro and renal management, and we have proved by operating these kind of patients. Thank you.